I'm Barbara Wrightson, and I am an American citizen, but I currently reside overseas, and I'm an educator. My life before the diagnosis, for decades, I will say, has been a series of autoimmune issues, starting with hypothyroidism when I was a teenager, and medication for that, and then carrying on to drug allergies of many types, food allergies of many types, and I had digestion pain so badly. One time I even blacked out and had to go to the emergency room because the pain was so intense I just couldn't handle it. The neurological symptoms were sort of the last thing that came on with me. I think it started with autoimmune, then moved to, probably 3 decades ago, and then moved to digestion issues, and then it moved to neurological issues. But 4 years ago, I had toxic mold poisoning, and I went to 4 different doctors. I couldn't get a diagnosis. So I traveled around to different doctors, and I ended up having to diagnose myself. And that was when I met my friend Stuart Slay, who had been here at Envita. At the time, he knew he had Lyme disease because he'd had a tick bite, 8 years prior, and he knew the symptoms of Lyme. He'd done a lot of research. He'd been to a Lyme doctor before. He said to me, you have a lot of symptoms of Lyme. You really should get tested for Lyme. So I called and left a message at the time because I think I was in Asia, so it was a different time zone. So I left a message. Danielle called me back. Danielle was Stu's PCC as well, so that's why I connected with her initially, because Stu and I have many, many similar symptoms. So she called me back and we talked through kind of what I've already just said, a series of the history of my health issues. And she said, "Oh my gosh, you've been through so much." And she said, "Yeah, you do sound a lot like what has happened with Stu. We really would like you to come here and do the testing and see if we can help you." And she said, "We really, really want to help you." And so Dr. Coffin and Dr. Matthias went through my files and all my charts. They took a bunch of tests. I think I did 40 vials of 40 vials of blood and all sorts of other things, really comprehensive testing, which was really good. It was nice that it was 2 of them together too, because I think they have a nice symbiotic relationship between the 2 of them. Their confidence in the whole process was really good because they were spot on. 4 to 6 weeks later, it was exactly what they told me. Everybody's here pretty much for the 2 things, Lyme or cancer, and it's understood that when you walk in the door, you're not healthy and you're not feeling well, and people really embrace you when you come in the door. I think it's great. You can really hear the staff being very uplifting and very encouraging and very focused on you and what can I get for you and how can I help you. Even just a simple thing like, get you a cup of tea or get you a blanket. Are you cold? Are you hot? Do you want the blinds closed? Those kind of things are, those little things which it'd be hard to find them elsewhere in the world without such personalized care. I was so amazed with, Julia or Shannon or Emma when I was in IRAD. They would remember when I was there the last time, oh, this happened or that happened, so, let's do this differently or that differently. After the 5th time I did IRAD, I noticed how much my neurological symptoms were clearing up. I went out shopping and was walking through a mall, and I realized for the first time in, I don't even know how long, but years, I don't know if it was a decade but it was literally years, I was walking and I didn't have this sense of imbalance, like this sense of I've got to hold myself carefully because I'm going to trip and fall. I don't know where else in the world you could go and get that kind of testing that you could get here to get that clarity on what are all your symptoms coming from and how to treat them. The other big thing I think with Envita is the IRAD, which I guess maybe I should say that's the insulin receptive antibiotic delivery. I guess people can look it up on their website, but it's, that moving the antibiotics past your blood-brain barrier to get it into your neurological system is really key. And I think the IRAD just does amazing stuff to clear up. For me in particular, I can't speak for everybody obviously, but for me it really did a lot to clear up my neurological symptoms. I don't know where I would go. Where would I go in the world to get that? There's very few places you would get it beyond Envita.